Hi, this is Dr. Quinn. I'm the owner of No Tooth Pediatric Dentistry. If you have questions or you want to watch more videos like this, you can find me on Instagram or here on YouTube. This video is for my patients or anyone else who's interested in this. Today, as my patient, we talked about breathing. And you say, why is the dentist talking about breathing? Well, breathing is actually very important for your mouth health. So, depending on how your child breathes, whether that's through their nose or through their mouth, that can affect if they get cavities, if they get gum disease, and then very importantly, it can affect how their teeth, smile, jaws, and face grow and what that develops into. So today we're going to talk about mouth breathing and nasal breathing. The first thing we'll talk about is mouth breathing. Our mouth was designed for eating, chewing, and for speaking. It was not designed for breathing. So today we'll talk through some reasons why you do not want to mouth breathe and what we see happening in the body and to the face and the jaws and the teeth when we or our children mouth breathe. But the first question is, how do I know if I'm mouth breathing? How do I know if my child is mouth breathing? For you or for your child, if your mouth is open at nighttime or their mouth is open at nighttime, or during the daytime, if their mouth is ever open when they're not speaking or when they're not taking bites of food, then chances are that your child or you are mouth breathing. So we'll talk through some things why you would not want to mouth breathe. Studies show that people who breathe through their mouth have a smaller mandible. You see this baby's mouth is open and their jaw is back. Now, this is not a fair example because most babies have a very small jaw that looks like this. So it doesn't mean that this baby here is doing anything wrong or that they're going to have a small jaw in the future, because almost all babies do. But when we look here, you can see that the chin is further back and then the mouth is open. He's just playing. But multiple studies have shown that people who breathe through their mouth, they end up with that smaller chin and smaller bottom jaw. The other thing that you'll see is that increased gummy smile, because with the lower jaw open from the mouth breathing, then the top jaw continues to grow downward and you see more of that gums when you smile. And all of this, the way that it affects the top jaw, the way that it affects the bottom jaw, the position of your jaw actually affects how big your airway is, which is back in your throat where you breathe, because of the tongue position and the jaw position. So mouth breathing has a negative impact on the way that your child's airway develops. When you breathe through your mouth, you keep your tongue down. Your tongue should actually rest up on the roof of your mouth. So if you were to close your mouth right now and breathe through your nose, most of us, our tongue should go up and suction cup up to the roof of our mouth. If we breathe through our mouth with our mouth open, then we get what's called a low tongue position. So a low tongue position will lead to this here called a tongue thrust, which is where your tongue pushes against your teeth and it leads to more mouth open posture. The other thing we'll see is tooth grinding. So parents say, well, why is my kid grinding their teeth? There can be a number of reasons, but a lot of it is if they're having trouble breathing at night because of this smaller airway from mouth breathing, then if you grind your teeth, you pull your jaw forward, you see that, and you tense your airway, making your airway a little bit bigger, getting your tongue out of your throat so your child can breathe better at night. The other thing you'll see is a narrow top jaw. So you'll see that narrow jaw. We call it a V-shaped dental arch, so you don't get that big wide smile. So what you want is you want your tongue to push up against the roof of the mouth, up here, like a big flat pancake. If that happens, you get a big wide top jaw or maxilla. If that doesn't happen, you get this V-shaped arch, we call it, or a very narrow top jaw. The other thing to think about is the length of the face. So when people have their mouth open, then the face continues to go downward and you end up with this one called dolichofacial, or a longer face. Okay, so I've probably convinced you don't want to breathe through your mouth. We don't want our child breathing through their mouth. We want to breathe through our nose. So our nose was designed for breathing. So what it does is it filters the air, it warms and humidifies the air. And by doing that, it actually increases oxygen uptake. So you get 10 to 20% more oxygen intake per breath when you breathe through your nose versus your mouth. So it improves your breathing efficiency. It also, multiple studies have shown that it reduces the risk of illness because it filters the air, it moistens the air, you have less inflammation, you're taking less things into your lungs without filtering. Breathing through our nose lowers blood pressure. There are multiple studies on this, and you can feel this, right? We're supposed to take those long, slow inhales through our nose. What that does is reduces our blood pressure. And then why we're talking about it is it supports your oral facial development and health. What that means, healthier teeth, healthier gums, and better facial growth or facial aesthetics. So as the dentist, I think about nasal breathing because I see less cavities and less gum disease. There are multiple studies showing that people who breathe through their mouth have more cavities and more gum disease. The reason for this is your saliva protects your mouth. It protects your gums, protects your teeth. And when your mouth dries out from breathing through your mouth, then you get more overgrowth of pathogenic bacteria. Your teeth and gums cannot be coated with the protective factors of saliva, so you have more cavities and more gum disease. Also, the other things we talked about is when you breathe through your nose, you're going to get better facial balance. The way that your child's face grows is better. And then also less orthodontic needs, less crowding, less crooked teeth, and just an overall better balance of the face. So what do? I don't want my child to breathe through your mouth. Now I've watched this video. I think maybe they're breathing through your mouth, or Dr. Quinn, you told me that they might be breathing through their mouth. Well, when they're really young, we talk about building that habit. So as soon as your baby's born, if you see them with their mouth open, then you gently push their mouth closed. So you see here, we're not pushing on the hard part of the behind that, where the mouth is soft. You can push there, and you imagine you pushing that tongue up to the roof of the mouth, suction cupping the tongue right where it should be on the roof of the mouth, and that allows the baby to begin the habit of breathing through their nose. You do this after feeding and when the baby's asleep. This is an ancient practice. This has been around for hundreds or thousands, actually, of years in many cultures. However, unfortunately, today in our Western culture, this is not something that's typically taught to new parents. The other thing I do, I have all parents using a xylitol nasal spray for their children. My own 3 kids, we line them up every night with the nasal spray. We live in Los Angeles here. There's a lot of pollutants and allergens and irritants that end up in our nose, and we want to reduce congestion. So using a xylitol nasal spray reduces congestion and inflammation in the nose and helps keep it clean to allow better nasal breathing. Some patients, we might talk about some myofunctional needs. Myofunctional just means the muscles of the face. How do we move the muscles of the face and the mouth? So there are little appliances you can use, or sometimes you'll work with a myofunctional therapist. There's like a speech pathologist who has special training in helping teach you or your child how to breathe appropriately or how to swallow appropriately. And that can actually change the way that your child's face grows based on how they're breathing or swallowing. The other thing to think about is a tongue tie. Most kids' mouth breathing, the tongue tie is not the reason. But if you have a tongue tie, like these patients here or this baby here, then the tongue is held low. You can't put it up against the roof of the mouth like it's supposed to. So a lot of patients who have tongue ties end up mouth breathing. So today we covered breathing, why we should breathe through our nose, why we don't want to breathe through our mouth, and then how that affects the way that our child's face grows. If you have questions, let me know how I can help, and we are here for you. Thanks so much for being patient at Note 2.